Good morning, good afternoon, everyone. Thank you for joining us and welcome back to the third and the last day of Alliance and Partnerships for Patient Innovation Solutions, APPIS 2022. My name is Bahija Gouimi. I'm the president and the founder of Amal Association based in Morocco, which is a Sehmi leukemia advocacy group. I am myself a leukemia patient for 20 years. It's such a pleasure and honor for me to be a council member of the APPIS, representing the Middle East and Africa region of chronic myeloid leukemia advocate network, to work together to help and strengthen the patient community to have more impact in Asia Pacific, Middle East, and Africa. I will now give the floor to my colleague Kawaldip, who is a council member of APPIS and the CEO of International Alliance of Patients Organization. Over to you, Kawaldip.
Thank you very much, Bahija. Nice to see everybody who's joined us. So welcome everybody, wherever you are. It's always customary to say good morning, good afternoon, good evening. I think that's important for us. It's my pleasure today to bring to you great insight. I think we have had a great 3 days of 2 days of deliberation. And as a cancer patient, colorectal cancer patient myself, I thought it was great to hear from patients who have similar experiences as I had, but there are others who had worse experiences than I had. And all this added to my understanding. This morning, we've got a very great agenda tied up for you. But let's recap on what happened on day one and day two. On day one, when we started, the perennial question that we have raised, how do we become expert patients, was coming through and through, that it was about health literacy. It was not only improving about our own health literacy, but also the health literacy of our family and friends. And this was all about empowering patients, finding solutions, and advocacy tools that were credible. We needed to get information that was accurate, pertinent, and right at that time for that stage of your disease. And it needs to be acted upon by everybody in the region. I think the region needs to set standards in that. I think we all agree. There should be tools that should be developed in health literacy that are in alignment with the health care and other stakeholders, and make sure that the language and the level of these tools are balanced. Healthcare professionals should have what they need to do. And that language, I think, was in two ways. It was not only the language of common communication, national languages, but also the language of the communication material and paper. That needs to be really addressed. And I think day one was all about those toolkits we had seen. There were ways of improving and plenty of innovation. I think Asia loves to talk and Asia loves to share. I think that's something that came up through very clearly from that. Patient organizations are happy to share. And that's something very unique for us, I think, in Asia Pacific. We don't hoard things, we share open resources for everyone. Now, then we moved on to day two, I think, and day two was very important. I think what I liked was that for the first time in many organized events in the area and the region, APPIS really brought something about how to do things systematically and systemically. So meaning you do it by one, but then you do it across the health systems, that you should have policy congruence. The policies should meet each other. You shouldn't have 2 or 3 policies working differently, policies that should be working together. And for that to happen, we said the solution was that we must elevate patient voice in policy development. That we had some very good excellent speakers, that the policy development is patient engagement. We can't have policies that haven't got end users within it. Whilst we are being now seen as unconventional partners, we shouldn't be. We should be the norm. We should be instituted in that health policy creation. And then understanding people beyond that policy, who is going to be affected by this initiative. We have to look at the taxpayers, we have to look at the innovators, we have to look at industry, and we must address those gaps. It's collaborative working that came through. I think that all sectors of the government and patient organizations must work together. I think that was the day too. And there were some innovative solutions. I mean, if you watch the recordings, you'll see those, what needs to be done, how it needs to be acted upon. And it was about working collaboratively. I think Asia Pacific exemplifies that. We don't have that adversarial approach to policymakers that other regions have. We always like working in harmony and in understanding, and that's how we've changed things. Yes, in some areas, change may be slow, but when that change happens, it's effective and permanent. So that's something which was very significant. Living here in Europe, I can see that we have changes made on the cuff, you know, through hard advocacy. And then after 2-3 months, it's all gone. It doesn't last. In Asia Pacific, we say yeah, change happens, it lasts forever. Then something that came about was that what are we basing our policy on, you know? What is it? And we said, without data, high quality data, pertinent, relevant, accurate data, and that data should accurately reflect what we are thinking of, that patient preferences needs to be in that data. I think that's something I really emphasize, and I think what we found this in that day too, that patient preferences need to be put across strongly. You can't have health technology assessment bodies working in darkness. They need your data. They need your preferences put across strongly, and they need to be impactful communication. And that communication, I think, will be start of today. My next speaker would be coming from that ilk, as I introduced them. And it's very important that patient-centric data sets are made public and shared with the prerequisite of making sure we have got strong frameworks of guarding privacy and making sure that confidentiality is not breached, the identification routes are not adhered to. Something else that I saw during the 2 days was the amount of sharing going on. And I think I am so pleased that once the language platforms are being used extensively everywhere, some people who thought they were not proficient in speaking English, but they could write. Yeah, okay, and they could write quickly. I will now wrap up and say that I'm preparing now for our next speaker. And if I could look at our speaker would be Javier Boix. Javier Boix comes from the global, he's the global head of Pharma.
I think Kawaldip, before that, we should, sorry, thank you very much, Kawaldip, for sharing with us what's happened in the 2 days of the summit. It's very interesting and it will be very helpful for our community. So the theme of APPIS Day 3 is dedicated to digital health and communication. This is a very important topic to be tackled in this summit, as it enables for sustainable development of patient advocacy group in funding, collaboration, communication, etc. in the new normal. I'm extremely excited about today's agenda. We have plenary session, leapfrogging with digital health, patient organization of the future, with 2 concurrent sessions. The first one running a patient organization virtually, and the second one co-creating digital solutions with healthcare consumers. This year, APPIS launched APPIS Innovator Program to recognize and support patient organizations that have found innovative ways to amplify voices, patients' voices. And it certainly will be will help the community to grow, scale even further, and continue to improve outcomes of healthcare consumers. Today, we will have the pleasure to listen to live presentation by shortlisted patient organization. And after the summit, APPIS will continue to support patient organization for sure through capacity building modules. And today we will have the opportunity to discover and know more about APPIS Academy 2022, which is a continuous and year-round offerings and engagement to enable capacity building and real-world impact. Now I will leave the floor to you, Kawaldip, to present our next speaker. Thank you.
Thank you very much, Bahija. Very excellent layout of the day, and I think you really emphasize how important this day is today for everybody. Now it's my pleasure, as I've already intimated, to introduce a very good communicator. I think something that we had been saying in day one and day two, communication needs to be good. And I think from Novartis' point of view, we are now hearing, as we say, from the bee's knees. It's the best of the best. And I have the pleasure of introducing Javier Boix. He's the global head of pharmaceutical communication and patient engagement. And I know of Javier for a long time. He's an excellent writer. He's wherever it's presented, he's really presented very neatly and very patient-centric, if I can say that, you know. And that's something I enjoyed very much about Javier's approach. He's very patient-centric. He can change his speed and he can change his level. And over to you, Javier, to that. And thank you for helping us get that idea of how we should be conducting. Thank you.
Good day, everyone, and welcome back to the third and final day of the 2022 Alliance and Partnerships for Patient Innovation and Solutions Summit. My name is Javier Boix, and I am the Global Head of Pharmaceutical Communications and Engagement at Novartis. Today's topic of digital health and communications is one which not only intrigues me, but it's also very dear to me and my role at Novartis as we continue to elevate the way we engage with the healthcare ecosystem. Advancements in digital technologies have brought people closer and better connected and made information widely available. This has been invaluable in the past 2 years when many of us have been physically separated from loved ones, from colleagues, from healthcare providers, and from other sources of support. At the same time, this has not been without its challenges. Digital communications has become an increasingly crowded space with the proliferation of false and inaccurate health information, making it harder to find reliable and trustworthy information. It is critical that accurate and reliable health information is accessible to patients and caregivers. This is where partnerships with patient groups and leaders, such as yourselves, play an important role to reach patients and caregivers with the right levels of support and trusted information in a way only you can. I also recognize the benefit of multi-stakeholder partnerships, which is why I'm delighted that we also have policymakers, payers, physicians, industry, and academia with us this week. In my view, there's one critical thing that partnerships and digital have in common. They both help to bring scale. In fact, look at us right now. Technology has made the APPIS Summit possible, allowing us to have important discussions from locations that are most relevant to each of us, making it possible to involve a greater number of people and countries that would have been possible if this were a face-to-face meeting. This is why I'm also excited about the APPIS Innovator Program taking place this afternoon. With the APPIS Innovator Program, we aim to recognize existing initiatives by patient organizations that have created a positive impact on patient lives and provide support that will help scale these programs and share success so that more people can benefit. Later today, you will also get sight of the upcoming APPIS Innovator academic curriculum, which will see a series of online workshops on key topics or areas of interest for capability building. The APPIS Academy is made possible by our APPIS partners and will be available in multiple languages to serve our diverse region. A big thank you to all our APPIS partners for making this possible, including but not limited to the Advanced Breast Cancer Global Alliance, UPATI, and Patient Focused Medicines Development. Thank you again for joining us, and I wish you an exciting and productive final day with us at the APPIS Summit 2022.
Thank you, Javier, for your talk. And definitely we need to work together with patients and all stakeholders to improve patients' outcomes.